How many of you have struggled with anxiety or depression? Anxiety and depression are the most common mental illnesses in the United States, affecting up to 40 million adults. These specific mental illnesses often coexist together as one can trigger the other. The fight against anxiety and depression is not addressed enough, and we need to spread awareness in order to help others know that they are not alone. Today, I will first talk about what anxiety is and the different types that people may experience. Second, I will help explain what depression is and hopefully give you a better understanding of what it's like to live with depression on a daily basis. Finally, I will talk about the different kinds of treatments for anxiety and depression as they are very similar. According to Medline Plus, the article says, anxiety is a feeling of fear, dread, and uneasiness. Symptoms of anxiety include sweating, the feeling of being restless or tense, and having a rapid heartbeat. These symptoms can also be normal as a reaction to stress, for example, like taking a test. However, anxiety disorders are conditions in which anxiety does not go away and actually tends to get worse over time. Constant anxiety gets overwhelming for most people who are suffering from it. The Anxiety and Depression Association of America says, anxiety disorders develop from a complex set of risk factors, including genetics, brain chemistry, personality, and life events. Anxiety disorders can interfere with daily activities, including schoolwork, job performance, and relationships. There are various types of anxiety disorders. The most common anxiety disorders are generalized anxiety disorder, panic disorders, and phobias. Generalized anxiety disorder is described as an excessive worrying about day-to-day issues such as health, work, money, and family. A person with generalized anxiety disorder will have these fears every day for at least 6 months. Panic disorder is described as having panic attacks, which are sudden and frequent periods of feeling intense fear when there is no reason to. These panic attacks appear quickly and can last up to 2 minutes or more. Lastly, phobias are described as having an extreme fear of something that presents little to no danger. Some common phobias are having a fear of spiders, large crowds, flying, or being in social environments, which is known as social anxiety. These 3 types of anxiety disorders have different symptoms, although they all have a combination of anxious thoughts that are hard to control, physical symptoms like rapid heartbeat, unexplained pains, dizziness, shortness of breath, and lastly, changes in behavior, including avoiding everyday activities in which one used to enjoy. Medline Plus says the risk factors for the different types of anxiety disorders can vary. For example, generalized anxiety disorder and phobias are more common in women, but social anxiety affects men and women equally. Social and environmental risk factors for anxiety disorders include a person's personality traits like being shy when in new situations or meeting new people. Traumatic events during childhood and even adulthood could also lead to anxiety disorders. Physical and psychological risk factors for anxiety disorders include health conditions like thyroid or arrhythmia problems, and also a family history of anxiety or other mental illness. Anxiety disorders are real and can be caused by various risk factors, including genetics, environment, and personality traits. There are many indicators that a person may have an anxiety disorder, such as sweating, changes in behavior, and shortness of breath. There are many different types of anxiety disorders, but 3 of the most common ones are generalized anxiety disorder, panic disorder, and phobias. In addition to anxiety disorders, another common mental illness is depression. The American Psychiatric Association defines depression as a common and serious medical illness that affects how you feel, the way you think, and how you act. Depression causes feelings of sadness and/or a loss of interest in activities you once enjoyed. Depression is a disorder of the brain. The causes of depression are very similar to the causes of anxiety disorder. Causes of depression include genetic, biological, environmental, and psychological factors. Depression is most common in women and can be developed at any age. However, depression usually begins in teens and young adults. There are many symptoms of depression. Some symptoms include feeling sad or empty, loss of interest in activities, overeating or not eating enough, not being able to sleep or sleeping too much, feeling drained or fatigued, feelings of hopelessness, guilt, anxiousness, irritability, aches or pains, headaches, cramps, or digestive problems. The scariest symptoms of depression is the thought of suicide or death. There are also various depression disorders, which include bipolar disorder, postpartum, clinical depression, and persistent depressive disorder. Living with depression can be overwhelming at times. I found an article that may give you a better perspective on what living with depression is like for some people. Medical News Today says, depression is a real mental illness. Those who have depression cannot simply decide to stop feeling depressed. Unlike typical sadness or worry, depression feels all-consuming and hopeless. The article also gave a list of what it feels like to live with depression. People living with depression may feel like there's no pleasure or joy in life. Everything feels hopeless to them. It is also harder to concentrate as you are unable to think clearly and make any kind of decisions. Also, self-esteem is most likely absent in a person living with depression. They often have feelings of worthlessness and being a failure. Depression can last months and even up to years. People suffering from depression disorders often have difficulty with their careers, relationships, and daily tasks such as self-care or housework. Depression is more common than we think, and it is a very serious medical illness. The risk factors of depression are very similar to anxiety disorders, such as biological, genetic, environmental, and psychological factors. Symptoms of depression include suicidal thoughts, feelings of being unworthy or hopeless, sleeping too much or too little, and not having an appetite or using food as a coping mechanism. Another coping mechanism that people with depression often turn to is drugs and alcohol. Although anxiety and depression can be scary, there are treatments and things that you can do to get better. Research shows that exercise can make a huge difference for people with anxiety or depression. Mayo Clinic says the links between depression, anxiety, and exercise aren't entirely clear, but working out and other forms of physical activity can definitely ease symptoms of depression or anxiety and make you feel better. Exercise may also help depression and anxiety from coming back once you're feeling better. Regular exercise helps ease depression and anxiety by releasing feel-good endorphins. These endorphins are natural cannabis-like brain chemicals that can give you a better sense of well-being. Other ways that exercise helps to improve symptoms of anxiety and depression are taking your mind off of worries, helping you gain confidence back, and to cope in a healthy way. In addition to exercise, therapy is also a great treatment to help overcome anxiety and depression. There are many different kinds of therapy options available. One type of therapy that may be helpful is called cognitive behavioral therapy. The Anxiety and Depression Association of America says it focuses on identifying, understanding, and changing thinking and behavior patterns. Benefits are usually seen in 12 to 16 weeks, depending on the individual. In cognitive behavioral therapy, the patient is actively involved in his or her own recovery, has a sense of self-control, and learns skills that are useful throughout life. Another option for treating anxiety or depression is medication. Using medication for anxiety and depression disorders is generally a safe and effective treatment that is often used simultaneously with therapy. The Anxiety and Depression Association of America says medication may be a short-term or long-term treatment option depending on severity of symptoms, other medical conditions, and other individual circumstances. However, it often takes time and patience to find the drug that best works for you. There are 4 major classes of medications that can be taken to treat anxiety and depression disorders. 2 of these major classes are selective serotonin reuptake inhibitors, such as Zoloft. These medications increase serotonin levels within the brain to help improve moods. Another major class is benzodiazepines, such as diazepam. This medication is used to treat physical symptoms of anxiety by reducing tension and boosting relaxation. There are treatment options to help people who are living with anxiety and depression. Regular exercise can make a big difference, and there are also therapy and medication options. According to a 2013 Medical Expenditure Panel survey, more than 1 out of 6 Americans take an antidepressant or a sedative. In conclusion, I first talked about what anxiety is, the symptoms, risk factors, and some of the different disorder types. Second, I talked about what depression is, defined as the risk factors and what it feels like to live with anxiety. Finally, I talked about the different treatment options for anxiety and depression. The fight against anxiety and depression is real. These issues need to be addressed in order for others to get help and know that they are not alone. During times like COVID-19, it is important to spread awareness to people who are struggling with their mental health. I hope that this information will help you or a loved one who is struggling with anxiety or depression. Anxiety and depression disorders are more common than we think, but getting help can have a huge impact on your overall well-being. Thank you for listening.